Good morning, everyone. So just a quick update on the COVID situation here in Australia. There's been quite a lot of interest and will continue, of course, to be a lot of interest in our vaccine strategy and our vaccine rollout for next year. My first point there is we're on track. Things are working well. It's very good to see international developments around the Pfizer vaccine now being given that emergency use authorisation in Canada, UK and the US, and we're looking to see what the real-world experience of that vaccine is as it rolls out in those three countries. And of course we're in very close contact with those three countries in particular and other regulators around the world looking at these new developments. When you think about how extraordinary it is, it's only 11 months ago that we had the first understanding of the genetic sequence of this virus, and now we already have the Pfizer vaccine out in the field being used in priority populations in those three countries, as well as now the likelihood that Moderna, another mRNA vaccine, may well get an emergency use authorisation in coming days. We've had the first trial results of the AstraZeneca vaccine, which is being made here in Australia, in Melbourne right now, and that's also looking promising. So we have the likelihood there will be three vaccines ready for rollout next year. Two of those we have in pre-purchase agreements here in Australia, and one of those is being made here in Australia. So these are all very positive. Just in terms of who's going to get it first, I can understand everyone now, because it is being rolled out in the world. They want to see when it might happen in Australia, the first doses, and who might get those first doses. We have our vaccine strategy that's been announced some time ago now, and we'll be following that strategy, which of course is based on the best medical advice. Our peak group that are advising us, the TAGI group, the Australian Immunisation Advisory Group, met in a long session yesterday afternoon to work through some of those details of that prioritisation. That will go into our announcements in January about that in some detail about who will be prioritised for the first vaccines. And so we know the general principles behind that. That's essentially those that are more likely to get serious illness, and we know that's mostly in the older age group, but also people with certain chronic diseases. So they will be part of the priority, assuming that that's what the evidence about the vaccine itself, which is presented to the TGA, demonstrates that it is useful and works well and is safe in those age groups. So that's the first priority, the people that are getting the most severe disease. And we know that the vaccines that have shown their results in peer-reviewed journals so far show very good results in terms of protection against severe disease, including in those that have the most likelihood of getting that severe disease. The second priority will be people that are putting themselves in the front line and caring for people that may have disease. So our healthcare workers, our aged care workers, they are the key. And then the third priority will be essential workers that are needed to keep our society going. And that's where that granularity will need to come out as to who is exactly the first in that queue. But I just really want to reiterate today that our aim for 2021 is to have anyone in Australia who wants to get this vaccine vaccinated. And so, yes, there will be a queue. This is an unusual event in our immunisation strategies, which we've had for many years. We usually start with having enough to roll vaccination out to anyone who needs it. This is a bit unusual because of the nature of how this is developing. We will have a supply by March, and we will start that process in March. But after that, we will get more and more supply, and we'll be able to roll out more broadly. So I think that information will come, and it will be very clear to the Australian public when it's ready to be so, guided by the medical expertise and the regulatory process through our world-class regulator, the Therapeutic Goods Administration. The other larger piece of news over the last day or so has been around this new strain of the virus in the UK. We are in touch with our UK colleagues about that. First thing I would say, this coronavirus is very different to the influenza virus, which can change quite rapidly and quite markedly. The coronavirus, this novel coronavirus that we've been dealing with all year, is actually very stable. It hasn't changed a lot through that period. Of course, we're continuing to look at that closely, but our understanding of the information so far from the UK is that this is a minor change, not a major one, and not related either to increasing transmission from person to person or severity of the illness that comes from the virus, nor does it appear to be in any way affect the effectiveness of the vaccines. So people should be reassured about that. Clearly, there are large spikes in the numbers of cases in the UK and many other countries right now, and we are in a very different situation here in Australia with very few cases over the last few weeks, and so quite a different situation.